So, my pre-op was yesterday, and it went just fine. We talked about the consequences of removing both ovaries for quite a while. We discussed the problems that come along with going off hormones. We discussed different complications that can occur. My doctor, sorry about my glasses. My doctor, she, after the hysterectomy, she does what's called a cystoscopy. I think that's what it's called. Where she puts the camera up the urethra into the bladder to make sure there's no leaks or, cuts or anything that was missed on the other, like the internal view outside the bladder. But she answered all sorts of my questions. I'm gonna grab my list so I can tell you the questions and the answers. Okay, so my first question was asking if I could get an anxiety pill the night before, because I would not be able to sleep otherwise. I just have, my anxiety's bad, and even though I'm super excited for this, I've been fighting for it for 7 freaking years, that doesn't mean I'm gonna be able to sleep. So she prescribed a single dose of an anxiety medication. I double-checked that I could stay on hormones. Since it's only a week away, I don't think it'd do much good anyway, and that shot day was day before yesterday. But I asked anyway, and she said, yeah, it'd be fine. I asked if she thought I would go through sudden onset menopause, like most people who get both ovaries removed. And she said maybe, but the other trans people who've been on testosterone, who she's removed both ovaries for, have not complained of that. I asked if I could get a photo of my uterus, and she said yes if she remembers. She said to remind her. So I will do that because I want to see my uterus. I asked how all the organs kind of fit afterwards, and the way she explained it, she said, it's like a bag of marbles. So when you take out the reproductive organs, everything just kind of, just fills the space. So it's not, I don't know what it'll feel like, but she hasn't had a hysterectomy, so she doesn't know. Let's see. I will need to be on vaginal estrogen for a while after surgery. Because people who've been on testosterone for a while, they have a really hard time healing the vaginal cuff. That's where they remove the cervix. So I will be on vaginal estrogen, which I may or may not be able to handle. We'll see. I asked if my vagina will still be self-lubricating, and she said it will probably be at whatever level it is now. I asked when I could go back on metformin, because I am supposed to go off of it 24 hours before surgery, and she said to ask the anesthesiologist, because every anesthesiologist has a different opinion. I asked when it's okay to get vaccines again, because I need vaccines for my surgery in Germany. And she said, whenever I want, but there is no literature on how well vaccines work in people who've recently had surgery, or at least no conclusive data. So she recommended that I wait till I'm all healed, if at all possible. I also have a sleep study scheduled for 2 weeks after my surgery, and I asked if she thought I should reschedule it. She said yes, because she didn't know if healing from surgery would be affecting my sleep. I also asked about stairs, because my bedroom is upstairs, and my cats like to escape, but we have a dog who needs constant access to outside. So I asked about stairs, and she said that I could make 1 to 2 trips a day, but she doesn't want me going up and down much. And I think that's it. She also gave me post-op instructions. Well, it's pre-op and post-op. And there's all sorts of stuff. One of the things is it wants you to avoid certain medications and supplements. Aspirin, Advil, ibuprofen, Aleve, naproxen. Those are expected. But it also wants me to avoid ginkgo biloba, feverfew, garlic, ginger, ginseng, fish oil, vitamin E, turmeric, and weight loss medications. None of which I'm taking, but I'm telling you. I will be getting a call from the hospital to discuss stuff. My medications, medical history, etc. So, we'll see what they have to say. I can't eat or drink anything from 8 hours prior to your scheduled arrive time. And medications, necessary medications should be taken with a small sip of water. And inhalers should be taken with me to the hospital. Which is weird, but like, okay. Morning of surgery, I need to shower with an antibacterial soap. I don't know if it's only in the pubic area, or if it's my whole body, or what. That's one of my additional questions that I have to ask. I cannot put on lotion, perfume, deodorant, nothing. Not chapstick either. The chapstick and the lotion is going to be the hardest part because I have really dry skin. I mean, I live in the desert. I'm going to read this word for word, and you might need to take a deep breath. Dress in loose, comfortable clothing. You will be wearing a pad home. I expected it, but seeing it written out was... And of course, I need to bring my insurance card, payment, etc. But I need to bring a case for my glasses, which is weird if you don't think about it. But if you think about it, they don't want to worry about scratching your glasses, because they'll probably just put them in a bag with my name on it. Okay, after surgery. On the evening of surgery, it says to make sure you are out of bed more than 2 hours, including short walks and sitting in a chair. The day after, plan to be out of bed most of the day with frequent walks. Walking helps to prevent blood clots and help with the healing process. Because I've been bedridden for most of the last 5 years, I'm going to ask if that applies to me because I haven't had an issue this far. I don't know if surgery increases that risk. I just ended the video instead of paused it so this may be a little weird. Sorry. It says to avoid narcotic pain meds as much as you can. I'm not going to worry about that because I have enough pain. But I talked to my pain doctors, and because I can't get pain meds prescribed by anyone other than them, or else I get kicked off their program. So I talked to them, and they said I can be given IV pain meds, but with other pain meds, it has to be prescribed by them. They gave me a new prescription specifically for my surgery. So, also I want to show you my, oh, I missed. Oh, wow. My cat was going to have another chance to show you. Oh. You're standing on my papers, darling. Alright, I need the papers now. Yes, I know. Let me have the papers. Thank you. It says, after laparoscopic surgery, you will have several small incisions on your abdomen. If you have a dressing, such as a Band-Aid on these incisions, you may remove it after 24 hours. If you have surgical glue on the sites, you may leave it on until you see your doctor. I'm allergic to most adhesives, so I'm going to remind her of that. So it might be better for her to suture them for me. It says you may shower the day after surgery. You may get the incisions wet. Avoid baths until approved by your doctor. Okay. It says after laparoscopic surgery, shoulder pain is normal and may last several days after surgery. Sometimes a heating pad on a low setting for 10 to 15 minutes at a time on the shoulder can provide some relief. And that's because during the surgery, in order to improve visibility, they put a whole bunch of carbon dioxide into your abdominal cavity. And that can float up to your shoulders and cause a lot of pain. It says mild vaginal bleeding is normal. This may occur intermittently for a few weeks. You may wear a sanitary pad or panty liner as needed. Do not use tampons. The tampon bit is because there's a good chance it could touch the healing vaginal cuff and it could heal into it, which, if you've ever had something heal into a wound, not a good time. It says to prevent constipation, eat high-fiber foods, drink at least 8 10-ounce glasses of fluid each day. You may take a stool softener if needed. I'm not too worried about that because I have IBS-D. I have issues with diarrhea pretty much constantly. So I'm kind of looking forward to it, not going to lie. It says, after surgery, do not drive while you're taking opioid or other narcotic pain meds. Walk as often as you feel able. Avoid strenuous activities such as running for 6 weeks. Do not lift anything heavier than 10 pounds for 6 weeks, which means I cannot pick up my cats. It says don't have sex until you see your doctor at your 6-week follow-up. Do not place anything into the vagina. Ask your healthcare provider when you can return to work. I don't work, so that's not a problem for me. But I know it depends on what kind of work you do. And some other factors. Like, how the surgery went and stuff. It says to call your doctor if you have a fever of 100.4 or above. If you have vaginal bleeding that soaks a pad in 1 to 2 hours. If you have persistent nausea and vomiting, difficulty urinating, severe abdominal pain that isn't controlled by the pain medication my doctor has prescribed, bad smelling discharge, or shortness of breath or chest pain, which are all just signs of infection. Something else that I asked was, I said something like, I presume you'd tell me if you see something abnormal while you're in there that's not the reproductive organs. And she said that there's a part of the paper I can sign of the consent form saying that if she finds something, that she can call in an appropriate surgeon to have them fix it then. The example she gave was, if there's a mass on my bowel, she can call in a general surgeon and have them remove it. And I think that's great. So that way I'm not having to heal and then turn around and have another surgery and then heal again. So I'm pretty excited about that. Because if they do find something, I'd rather them do something about it immediately. So, alright. I think that's it. I do have a few more questions for her. But I think that's all I need to tell you guys. Sorry, I was checking that my hair is still in a pony. Because it was looking kind of like a mullet, and I was offended, because my hair is not a mullet. All of my hair is from here, and stops right about here, so. Okay, anyway, thank you for watching. I will keep you updated as things happen. Have a lovely day.